So my name is John Martin. I'm a consultant gastroenterologist at Imperial College Healthcare in London, with a special interest in lower GI investigations, particularly bowel cancer screening and colonoscopy. I'm also the lead of the West London Bowel Cancer Screening Centre and the National Advisor to Public Health England for bowel cancer screening endoscopy. So why did I want to become a doctor? Well, that's difficult. I've always wanted to be a doctor since as long as I can remember. So it's very difficult to answer the question as to why. However, looking back as to whether I think that was a good decision, I definitely do. I've thoroughly enjoyed my career and my choice in terms of the intellectual challenge of the job, and also the variety of the job, and also just meeting people on a day-to-day basis. Both patients and medical colleagues makes the job extremely enjoyable. Why did I choose the specialty that I'm doing? Again, it's difficult to be entirely sure as to why. When you're training as a junior doctor, you are exposed to a variety of different specialties. I think you're influenced often by the people that you work with, and I've always found gastroenterologists a very enjoyable group of people to work with, and that will certainly influence my choice. I also enjoy the practical aspects of the specialty, allowing to do endoscopy and colonoscopy. I find enjoyable as something slightly different to ward work and clinics. So I grew up in a small village outside of Bedford, which was interesting. It was nice in the sense that you could just wander around in a small village, but difficult to get out of the village with the last bus back from Bedford being at 6 o'clock in the evening. So it's a different environment to where I work now in London. The most rewarding thing I find about my job, I think, is the patient interaction. I think it's challenging in two ways. One, the intellectual challenge of making a diagnosis and treating conditions, but also there are a significant number of patients, particularly in gastroenterology, who come with symptoms for which there is no diagnosis that is easily treatable, but there's certainly a lot of reward from reassuring those patients that their symptoms do not represent any serious problem, and also helping them manage and cope with those symptoms on a day-to-day basis.